to another episode of Simply Medicare. I'm your host, Debbie Strout, and delighted to have our next guest on here, Dr. C. And he's a specialist with our eyes. You know, our eyes are so important, but yet we might forget about going to getting them checked. And so Dr. C is here to talk to us a little bit about that and how to make it not scary. And we were chatting before we got on, and he's got a real pediatric personality. So I think his dad was a pediatric eye doctor. And so he carries that excitement, that enthusiasm, that wonder right over to that. So welcome, Dr. C. Let's hear your story.
Yes, thank you. Thank you so much for having me. I'm so excited to be on your podcast. Yes, I'm an ophthalmologist at Michigan Eyecare Institute with many different specialties in our group. And we pretty much take all the insurances, including Medicaid and even people that don't have insurance. And my average patient is around 75 years old. So I see a lot of seniors for many different reasons. Probably most importantly, the reason with just decreased vision, where they need to just come in and get a complete eye exam, which is so painless and easy.
Yeah. What are the things that can happen? I know when I was watching some, all the different things that you do and talking about that, they can have spots or blurred. I mean, what are some of the things that maybe we might experience that would be like, I better get a second opinion or even a first opinion on this?
Yes, good question. I think at this time of year with football and all the colleges are starting, we're going to see the Lions hopefully win their first great game this year. People are complaining. Yes, go Lions.
Yeah.
They're complaining that they can't see the TV very well, that the colors are blurry. They can't see the ticker tape under the TV. They check one eye versus the other. One eye sees a little better, and they're very distraught about that. And so one of the easiest thing is just come in, get the eyes checked, see if it's something very simple with just getting a new pair of glasses, which 80% of the time, that's what it is. But sometimes we find other things like there's some cataracts going on or something else going on that could be going on in the back of the eye. But it's a very simple, easy visit with us here at Michigan Eyecare Institute, where you're with us for 20, 30 minutes or so and basically get your eyes dilated if you're able to. And we help you with sunglasses on the way out so the sun isn't too bright on your eyes, but it's a very painless and kind of a fun exam.
So you mean I get to have those really awesome, super cool glasses that are like this big and cover my eyes all the way back to my ears?
Yes, we have those. We also have the ones that are really thin that fit right underneath your glasses too. And people like those because those are ones you can just kind of sneak in your pocket, put them in your car, really easy. And it really controls like 80% of the light hitting your eyes. So you're not so light blinded when you leave.
Yeah. Oh no, I would get the big old ones. Those are the awesome ones. So for sure. I hear this all the time in the Medicare world. I've got cataracts, or I think I might have cataracts. How much is it going to cost to do cataracts? Let's not talk about the cost because I can help them with that on the Medicare end. But what are cataracts? What will you experience if you have cataracts, and how do you treat cataracts? Because I see it all the time.
Yes, great question. The biggest problem is people will complain. Night driving is such a problem. They'll say, Dr. C, I can't drive at night. I'm not visiting my friends at night because I don't see very well. I don't feel comfortable. A big thing is right now with football going on, people will complain that they can't see the TV that clearly or see faces very clearly. They'll also notice that colors aren't as clear and crisp. So that's one of the biggest things that can be alleviated with cataract surgery, which is the most common, the most successful procedure on the planet with up to 99+% success rate. And people will come in, get an exam. It's anywhere from 20 to 30 minutes where we totally check the eye from the front to the back to make sure there's nothing else going on and see if they meet the strict criteria with the affected daily living complaints. And then we talk to the patient and have a very genuine discussion with them about their benefits, about what type of lenses they would maybe choose if they want to be less dependent on glasses, or whether they would go with a standard lens. And depending if their eye is shaped like a baseball or football, they might need glasses just for reading. So
Mm-hmm.
it's a pretty straightforward um, procedure where people do really well. Long ago, it was like 2 weeks in the hospital with sandbags and all kinds of
My gosh.
protection. Yeah, now it's a 4 to 15 minute procedure where people do extremely well to the point where they're like, when can we go do the other eye, doc? And I say, well, let's just make sure this heals nicely, see how you do, and then plan accordingly to do the other eye when you feel comfortable.
Mm-hmm. Absolutely. So, is this a procedure that you do in your office, or do you do it more at like an ambulatory center? How does that work?
Yes, I go to two places here in Detroit. One's called CSSE, Cataract Specialty Surgical Center, right on Woodward between 11 and 12 Mile.
Mm-hmm.
Awesome people, awesome nurses, great experience. I also go to Straith Hospital, which is another incredible parallel quality place that's on Lasser Road between 9 and 10 Mile, which is a very sophisticated hospital, mostly just all eye surgery, whether it be for cataracts or glaucoma or retina problems, but they do see other specialties. But I would say 80% of that hospital is probably just for eyes. And that's an incredible experience for patients too.
Mm-hmm. So after cataract surgery, I'm freaked out by the eye. I can do anything except a stick in the eye and a loose tooth.
Sure.
Other than that, I'm out. I'm out as a mom. I'm out. I'm out. I'm out. But if is the procedure kind of scary? I mean, I hear people that are nervous about coming in. What can they kind of expect?
Wow, that's a great question. I would contrast it first. Like I have patients that are World War II veterans, where they'll come in, they have their IV hooked up, but some of them will say, "Hey, I don't want any sedation," or "Don't really need any sedation." Then you have the opposite of that, where patients are in the preoperative area, and we may give them a little sedation just to relax them. So then the trip from the pre-op area to the operative room, they're feeling totally relaxed. And that's what really makes the difference. Most people will say that when you have cataract surgery, it's like someone putting their hand on your shoulder and you might feel like a little bit of water, you might feel a little bit of pressure, but that's about it. And with that CRNA and that MDA, that medical doctor anesthesiologist in the room, they're able to, minute by minute, second by second, adjust the medication to the point that a lot of my patients are asleep while we're doing their cataract surgery.
That would be awesome.
Yeah.
That would be awesome. That would be totally awesome. Would you say that cataract surgery is probably the number one surgery you do, or are there some other ones that are right up there as well?
Yes, I would say cataract surgery is probably the number one thing that I'm doing at this time. Through the years, we did a lot of other different procedures, but now we're seeing so many people that just need cataract surgery, especially most common age in the United States, about 65 years of age, that people decide to get their cataracts. And like with our practice, we have so many people over 65. So we're just seeing an influx of patients that need that procedure. And you see over the years doing this now for over 26 years being in practice, how the technology is grown and just developed incredibly, where patients are just being able to see so much better without their glasses now, and colors are better, and the post-op care is so much quicker too. So it's really come a long way, but it's happening so fast these days.
Mm-hmm, mm-hmm. And it helps to improve their quality of life. I mean, why do you have to go through life seeing things blurry?
Exactly. And we're seeing more and more people too that have like light perception cataracts. And a lot of them are like in assisted living or maybe even like group homes and things like that, where they just didn't get access to the care. And they're coming now where you're able to take that cataract out, and they're potentially going back to 20/20 vision, which dramatically changes their life. And you're so excited to see them make the transformation and eyesight.
Mm-hmm. Yeah, I mean, you are just making a difference in so many lives. How long have you been doing this?
Yes, I've been doing this now for 26 years, and I feel like it's just gone by like like a like a like a vapor. It's just so fast, you know. But it's like one of those things that I love what I do. I love taking care of my patients, and I really love the people that I work with in our offices. We have a great staff. multi-specialty. So a lot of people, even if they just have to come in and get eye care for glasses, just to see if they have a glass problem, we have some of the best optometrists that work with us and take care of people. And that's actually a very uneventful and kind of a fun exam for patients, especially when they see the different frames that we have and all that. It's like kids like in a candy store picking out their favorite lens and frame.
Yeah, exactly. A couple of questions come to mind. One, you are an ophthalmologist.
Yeah.
What's the difference between an ophthalmologist and an optometrist?
Yes. An ophthalmologist is a medical doctor, someone who went to medical school for 4 years and did at least 4 years of additional training in their residency to specialize just on the eye. An optometrist is someone who went to a special school, an optometry school, learning how to refract and check the eye for glasses, along with checking the front surface of the eye and learning the different techniques and everything to examine, but they're not able to do the things we do, which would include like surgeries at this time. And
But
so it's a nice. Oh, go ahead.
no, are both of them doctors? I mean, do I say doctor optometry, doctor ophthalmologist?
Exactly. Yes, they're both doctors in their own field. And what's nice with our practice is we work together on the patients. Like if you were my patient, we'd have you come in, see if you need a well vision exam, see one of our optometrists who would check your eyes very, very detailed and see if indeed you need any glasses for reading or distance or both. Check your eyes to see if your eyes are shaped more like a football or a baseball, to see if you need any astigmatic correction. And then if indeed the optometrist found anything that looks like a cataract or other conditions of the eye, like glaucoma, which is a pressure problem in the eye, or any kind of macular degenerative problem in the back of the eye, those would be people that they would then send to the ophthalmologist in the practice to examine. But we'd continue to work very closely with the optometrist to continue to get the best corrected vision. So it's like a partnership. You're like, it kind of goes hand in hand, but we're both two distinct, different doctors.
It sounds like you have like a continuum of care right in your office. Is that fair to say?
Exactly. And that's really fair to say. What we do is we've seen so many people in our practice doing this now for 26 years. I have patients that I still have from the beginning when I started, which has really, really been a delight. And then you get to meet their family and their grandkids and everybody. So it's like we're all doing life together, but you're also building such good lifelong relationships. So that's one thing in our practice that we're able to do. And I think it's been a real blessing to have that in our practice.
Absolutely. Where I think, did you say, can you tell us where your locations are?
Yes, we're at 12 Mile and Telegraph there in
Yep,
Southfield.
that's
We've
right.
been there for many years. This is a practice that was started back in 1972. And then we have an office at Schoolcraft in Levan, just about a mile down from
That's
St.
right.
Mary's Hospital.
Yep.
And then we have a new office, relatively new office in Dearborn that we had to move from our old location. We're on Maple Street and off Michigan Avenue.
Yeah, right downtown then, right?
Exactly. Like the Eastbourne part of Dearborn.
Yep.
And it's in a beautiful area there.
Yeah.
Where you have access to all kinds of nice restaurants, great people, great neighborhood. So it's been a real delight to work down there too.
Yeah, awesome. Now, I wanted to circle back. So we talked about cataracts. What is macular degeneration and glaucoma? How do I, you talked a little bit about cataracts, but maybe I didn't fall into that category, but I'm experiencing something else.
Good question. Macular degeneration is the most common loss of vision, central loss of vision in the Caucasian population over 65. So people will come in and say, Doc, I'm reading my books, Bibles, and magazines, and it's like every other word is missing, or the page looks crooked or turned or warped. And what's going on? And I notice it maybe in one eye more than the other. And then what we do is we do a complete eye exam, a dilated exam, and we look very carefully in the back of the eye with our instruments, but we also have other instruments that we use too to analyze the surface of the back of the eye to see if there's any problem. It's basically a multifactorial causation that people at a certain age develop. A lot of it is genetic, and there are treatments available. We have 2 doctors in our practice that actually treat the wet type. That's the one, macular degeneration, where there can be bleeding in the back of the eye. It can be remedied with medicines. The dry type, unfortunately, we still do not have a genetic cure. Right now, ophthalmology has about 250 genetic cures for eye diseases, but we don't have one specifically for the dry type or the wet type of macular degeneration. But with now artificial intelligence, the sky's the limit how quickly that's going to happen, and hopefully something is going to happen real soon to cure that disease. As far as glaucoma, people really don't know they have it. They come in, get an eye exam, and their pressure is 24 or higher. You look in the back of the eye, and their optic nerve, which is the cable that connects your eye to the back of the brain, the little cup disc ratio is enlarged, and then it prompts the ophthalmologist to do some early testing to see if there's any damage back there. One of the first things you'll see is we do a scan called OCT, ocular coherence test, of the nerve fiber layer of the retina, and that'll show us some damage so we can detect glaucoma sometimes years before a visual field, which is a test where we check people's peripheral field. You can detect it so much earlier using that OCT. So it's one of those things that people wouldn't really know they have it. Some people have like a family history where they'll be like, oh, doc, I have this in my family. I thought I should get it checked out. Then they come in, and unfortunately, 85% of people, even if they have a family history of it, don't have it. So early detection is just key. Just getting a good eye exam. And I think anybody in their 60s who haven't had an eye exam, it's just good to just come in, maybe be seen once a year, just to make sure they have no possibility of any of these diseases.
I agree. I totally agree. And I know there's a lot of Medicare Advantage plans out there that cover at least a basic eye exam. So, and it sounds like you accept a lot of them. I mean, it's really important to protect your eyes. And how long does it take to get an appointment with you? Let's say I'm experiencing some of these. Maybe I've experienced them for a long, long time and have buried my head in the sand, or they've just popped up. How long does it take before I can get in and see you?
Oh, great question. If it's like an emergency, right after this podcast, I'm seeing you.
Okay.
So we can do that. We always leave room for those emergencies. For everybody else who's just coming in for a common, a simple exam, they can be in usually within 1 to 3 days, since we have the 3 offices and we have the 7 doctors. So fortunately, we have the wherewithal, thank God, to be able to get people in so they don't have to wait like 3 to 6 months to come in and see us.
Yep. I totally agree. And then, so it sounds like you've got, plenty of staff to help out, and you're located in different areas. What are, out of those 3, what's the one that you see the most? Was it the glaucoma that you see the most?
Right now, I would say cataracts.
Cataracts.
We're seeing so much more cataracts. And I think the big thing is for all our seniors, please, if you don't have a good pair of polarized sunglasses, let's get you some. Let's please avoid any secondhand smoke. Let's please control if there's any diabetes in your body, to get that sugar under control, because there's so many preventative things we can do, and hopefully surgery is always the last resort. Always. But I think just early detection and also protection, that whole idea of just making sure that everybody's doing what they can to just protect their eyes to the best of their ability.
Right. I swear this happened to me. I went in to get my eyes examined 100 years ago, and they could tell me, they could see like buildup, or they were like, is your cholesterol level a little bit high? I'm like, yeah. Family history. How did they know that just by looking at my arteries or veins or whatever it is that's in my eye?
Good question. We have this one scanner called Optos, which I love. It sees 82% of your retina, even if you're not even dilated. And you can actually zero in with this picture, and it's a beautiful panoramic view of your retina that no one else in the world looks like you in your fundus exam. And you can actually look at the vessels, you can look at the macula, you can look at the peripheral retina, and then you can see and look at the little arterioles to see if there's any buildup of cholesterol or any hardening. You can also see if there's any tortuosity of the back of the eye to check to see if anyone has undiagnosed high blood pressure. So there's so many things you can see back there. It's just like a picture's worth 1,000 words. And I totally believe that, especially with the ophthalmic pictures. So that's one thing with this technology now, we can see that. And then people that do have cholesterol buildup or something like that, we can do our part, of course, to try to protect you to the best of our ability, get that cholesterol down, get you on a good, heart smart diet and what have you. And then also, of course, talking to your family doctor to see if any medication needs to be used, if anything.
Right.
So I think and the first place things attack, especially like smokers and other diseases like diabetes, smallest vessels in the body are in the eye. So we can pick up that before they even know. Like, we'll have people come in and we'll say, hey, are you a diabetic? No, I've never really been checked. So then we send them to, the best people we know in their area. And they say, yeah, doc, you know what? Thank you. You saw the bleeding back there. We got it checked and now we're treating it. So the eye can tell you so much about the systemic situation. So it's exciting to see that and make a difference in someone's life.
Yeah, I'm sure you're making tons of differences. Let me ask you a question. So when I go in, I remember when my boys were little, they hated the poof. They were always, and they were scared of all of that.
Sure.
What is the poof?
Yes, that's that pneumatonometer. I love that you brought it up. It's that thing where you got your head in there, head's against and then you feel this pressure, and it's kind of scary. Fortunately, we don't use that anymore. Now what we use is just like a little anesthetic eye drop, numb your eye, and then we either check with a tono pen that you can't feel, or we use what's called an applanation tonometer, where we just put the special medicine in your eye with the anesthetic, and we just touch the eye without you even knowing, to the point you might not even blink, and it's so much better. But yes, that machine scared so many people, and it's like one of those things it's not good to have it in the office, because people are like, hey doc, I like you, but your test, I don't want to come back because I don't want to go through that again.
I don't like the poof.
Yes.
Nobody likes the poof.
That's right.
Even though it doesn't hurt, it just scares you. And you're like, keep your eye open. And you're like, I'm trying, but it doesn't, it's really difficult to do.
It's so difficult. And that's the thing. And then if you're sensitive, if you're used to doing it, then it's hard to just keep your eyes open because you're trying to, blink.
Don't blink, don't blink. So how long does it take to get an eye exam?
Yeah, the eye exam pretty much from start to finish with dilation usually can be done within like 15 to 20 minutes. It can go on longer. I mean, at our place, we're not in a situation where we're owned by private equity where I have to see so many patients per hour. At our place, we're one of the last free practices. So if you come in and you need my time, we can make extra time, answer all your questions, so you feel relaxed, refreshed. We develop a relationship. It's not like you're just with me for 5 minutes and what did that doctor say? So that's one thing we can really offer, not being a private equity ophthalmology practice. We have the time to spend with you, which is, I think, very, very helpful to many patients.
Of course, they want to feel taken care of. They want to feel special. They want them to be recognized. Hi, Mrs. Smith. Hi, Mr. Jones. They want to feel and have that relationship. So to me, that's really important.
Yeah, most definitely. I know, like, I'm a patient too, and it's like, if I'm with somebody, they're just going to spend like 3 to 5 minutes with me and I can't answer any questions, I won't feel that comfortable. I don't know if I'll go back. So
right.
Yeah,
right.
So we try to serve our patients to the best of our ability, make it like as if you're my sister, brother, mom, dad, to the point that we're trying to, be family, so we try to do our best.
Yeah. I feel like you're succeeding at that. I mean, I feel comfortable talking to you. You've got a great upbeat personality, and I'm sure you carry that with you throughout the day when you are seeing your patients.
Thank you. I love what I do. I really do. And growing up, seeing my dad being an ophthalmologist and being able to be in this profession for as long as I've been, I hope I can go another 25, 26 years. I hope.
Yeah. I think I've met my match as far as enthusiasm about their line of work, because I am so passionate about Medicare. And it's so nice to meet somebody else who really carries that passion. It's like, this is what you were born to do. This is what gets you up and going in the morning every day and gets you to go to work, and maybe takes that late phone appointment or that late in-person appointment or a Saturday or a Sunday appointment. Those are far and few between. I mean, you and I are out there in the business world, and it's rare to see somebody with as much enthusiasm as you have for your work.
To God be the glory. And I'm grateful that we both are doing something we really, truly love. And it's fun and it's great. And it's good to be able to be a servant to help someone with their conditions. And like I said, being an ophthalmologist, you sometimes get that instant gratification, depending on how dense the cataract is, where people can see right after surgery and read the clock and want to give you a hug. And you're like, wow, I'm glad I was able to be part of the process to really help you.
Yeah, I totally agree. So, can you remind us again the name of your clinic, your maybe a general telephone number, or the best way to reach you and to schedule an appointment?
Yes, most definitely. Thank you. Yeah, we're Michigan Eye Care Institute. Our website is misheyecare.com. The best number would be 248-352-2806. We have a great group of people that answer the phones, and I hope they treat you so well and get you an appointment with either myself, my brother Chris, Dr. Zelenik, Dr. Day, Dr. Rubenstein, Dr. Goldvelt, and also our Dr. Gordon, who is a real gem too.
Oh, I love it. Now your brother, what is he, an optometrist or an ophthalmologist?
He's an ophthalmologist specialized in cornea, but he does majority of the time general ophthalmology exams, and he's a great clinician. I'm so proud of him, and I'm so glad to be able to work with my brother. We were trying so hard to get my dad out of retirement, but he said, no, well, I've done this for 40 years and I'm 77. I think at this point I'm going to just rest. So we tried.
As he should. He has earned it. I'm sure he's helped thousands and thousands and thousands of people, as I'm sure you and your brother and all of the great staff there at your clinic has done that. We will be sure to put up a way to reach you, your phone number, your website. And I'm finding that the younger baby boomers are very active and know how to go to the website. So it'll be active. Can they get a full picture on your website of what you do?
Yes, most definitely. And I hope they come to the website. I hope they will come and let us take care of them. I hope they have an incredible experience. That's one thing, we're trying to be beyond best. So we're doing each and every day, trying to do the best we can to really take great care of people. And hopefully, if they have a great experience, they will let their friends and family know too.
Absolutely. As what I do, I mean, referrals from people that you work with are the best compliment anybody could ever give. Dr. C, any last thoughts, concerns, anything you want to let our listeners and viewers know about you before we end?
Yes, I'd just like them to know, prevention is key, like we've talked about, wearing the sunglasses, getting a good eye exam, and of course, early detection, especially with like glaucoma, where people are walking around, they don't even know they have that problem. So I think if they want to utilize us to get a great eye exam, a great experience, and good protection of their eyes, I hope they take a look at us and hopefully make an appointment and come in, and we hopefully deliver what they want.
Absolutely. I have 100% confidence that people are going to reach out to you. Thank you so much, Dr. C, for taking the time. I know you have a super busy schedule. I don't take that lightly, but thank you so much. I think this is really important that folks of Medicare age understand that taking care of your eyes is really important. You kind of have one set. I mean, I know there's other things out there, but you kind of have one set, and we want to do whatever we can to protect those eyes. Sunglasses are really important to do that. So, Dr. C, thank you so much for taking the time with being on with us. I wish you well. I hope you have a great rest of the year, and let us know if we can be of assistance to you.
Thank you so much. What a delight. And I sure appreciate you. And if you need us to take care of you, we'd love to see you.
Absolutely. My pleasure. And that's another episode of Simply Medicare. I'm your host, Debbie Strout.
If you've enjoyed this edition of Simply Medicare podcast and you don't want to miss any future episodes, please make sure to subscribe wherever you get your podcasts. Please also leave comments and offer feedback so we can make this podcast the best it can be for you. If you need assistance with your Medicare sign-up or you just have general Medicare questions, make sure to reach out to me at 248-227-0347. You can also reach me online at MichiganMedicareSpecialist.com or through my email at Debbie@MichiganMedicareSpecialist.com. I really look forward to working with you soon.